There's never a chance of using the same ink twice. All our inks are away from the tattoo area, so they can't cross-contaminate in that respect. Obviously, gloves that we use, new needles per customer. All the tubes have been specifically sterilised in marked pouches, so those pouches can actually be tested to make sure that they get to 134 degrees. So there's no form of cross-contamination in that. Also, we do spore testing once a month in the autoclave to make sure that there is no spores left in the autoclave that can carry pathogens with. To have a shop in this country, basically you have to be health registered with a local authority. Basically what that consists of is you have to have sterilisation equipment that is to hospital standard. You have to also be aware and have done courses in pathogens, blood transfer, blood spillage, and also, you know, have a knowledge of first aid.
It's just done professionally, really, like no dangers, no risks, and get the job done properly, really.
We ask people to fill in a consent form when they come into the shop, and obviously we hope they're honest on that. We have tattooed people with HIV and other like bloodborne diseases, but we treat them exactly the same. If we think every customer has got Hep C or Hep B or Hep A, we work exactly the same way through it, because you have to have a set way of doing it. So if you just think the worst case scenario all the time, then you're prepared for it.
Hepatitis C is a major but undiscovered global health threat. It's estimated that around 180 million people are infected with hepatitis C virus. If the infection is untreated, it leads to chronic liver disease, liver damage, liver cirrhosis, and the patients, they have high risk of developing liver cancer. For many years, it can be undiscovered. The patients, they have very non-specific symptoms, and the symptoms, they are in late stage of the disease. In HIV positive patients, actually the progression is much quicker. The problem is that only 40% of population have access to diagnostics, and even less to treatment in the world.
سختش هم این هستش که در نمونه‌های آلوده به قوه HIV و هپاتیت اینا دیگه شکلی دارن ترشح به چششون هست و دهانش. الان ما یه بیمار قلبی داشتیم.
In USA, the price for the new treatment is around $80,000, which means for 3-month therapy, which means, because it's given 1 tablet per day, which means 1 tablet costs $1,000. This is too expensive. It's just unaffordable for anybody else. And studies suggest that the actual cost of production of these drugs is much cheaper.
I didn't really know much about it. I kind of completely forgot about the fact it's a needle. Yeah.
Yeah, and like blood poisoning and all blood kind of things with dirty needles and things, yeah.